Welcome to this March of Dimes NICU Family Support Parent Education class. Today, we're going to talk about keeping germs away from your baby. Why are NICU babies at risk for infection? Babies have an immature immune system. Central lines and breathing tubes can increase the risk for infection. Most germs are transferred through your hands. Everything that comes into contact with your baby can transfer germs. So what's the difference between colonization and infection? A colonization are germs that are found on the skin or mucous membranes that do not cause illness. Everyone is colonized with germs. Some are helpful and some may be harmful. An infection is the presence of germs that cause illness like pneumonia or blood infections. Colonizing with helpful germs. Colostrum provides powerful passive immunization against germs. It's a source of probiotics. It colonizes the GI tract and it helps activate the immune system. Skin to skin promotes the colonization of the skin. It is helpful for both parents and guardians to hold skin to skin. Germs we want to avoid in the NICU. Staphylococcus aureus. 1/3 of the population is colonized with this germ. It is commonly found in the nose or ear canals. MRSA, methicillin-resistant Staphylococcus aureus, is a type of staph that does not respond to usual antibiotics. About 3 to 5% of the population may be colonized with MRSA. Other germs we want to avoid are germs that are found on wet surfaces, stomach viruses, and respiratory viruses. Respiratory viruses include colds, COVID-19, flu, and RSV. RSV is a common cold-like virus for healthy children and adults, but can be much more serious in young babies. So how do I keep harmful germs away? You can start by watching the NICU orientation video for more details about how to wash your hands and arms, or you can ask somebody to show you how to do this. A 1-minute wash should be done each time you enter the NICU. Use the hand gel often, especially when you go in and out of your baby's room, touch your face, nose, hair, mask, or phone. We greet each other with smiles in the NICU. Shaking hands can transfer 2 times the amount of bacteria than a high five. Before entering the NICU, remove all nail polish and artificial nails. Nail polish is shown as a source of germs. Germs cling to chipped nail polish and artificial nails. You will also need to remove all jewelry. This includes rings, watches, and bracelets. Jewelry is removed because it is difficult to get all the germs washed off your hands when rings and watches are worn. Keep your baby's area clean. Certain germs may be found on wet surfaces. Do not store items near or on the sink. If you place something on the sink by mistake, use one of the disinfecting wipes to clean it. Use the family designated cart or drawers for items such as small books and water. Regularly clean your hands and personal items that you use at the bedside. Wear the hospital-provided mask when in your baby's room and when a team member is present. Pinch the top of the mask over the bridge of the nose. Cover the chin and nose with the mask. Clean your hands. Clean your hands again if you touch or adjust your mask. Wipe your cell phone with the hospital-provided wipes before washing your hands. Gel your hands before and after touching your phone. Put your phone on a clean surface when in your baby's room. Re-wipe your phone as needed. Finding harmful germs early can decrease the chance of them spreading to other infants. Routine Staph aureus screenings occur in babies in the NICU if they have a central line, have a breathing tube, or weigh less than 2 pounds and 13 ounces. The screening is collected by swabbing the baby's nose. Babies on a ventilator may have a test done periodically to check for harmful bacteria in the windpipe or trachea. Babies with respiratory symptoms may be screened for viruses such as RSV, influenza, or COVID-19. All babies transported from other hospitals are screened for certain germs. So what if you're sick? It is very important to let your nurse know if you are sick or have been around others that are sick. Please do not come into the NICU if you have a fever, cold, cough, or any symptom of COVID-19. If you are sick to your stomach, do not come into the NICU until vomiting and diarrhea have stopped. So what else can I do to protect my baby? Get regular medical care for you and your family. This includes a flu shot, COVID vaccine, and Tdap booster. Encourage others who will have contact with your baby to stay up to date on vaccines. When allowed, bring clean blankets and clothes. Wash and dry on high until completely dry at home. Then place the clothes in a clean Ziploc bag directly from the dryer. Change your isolate blanket daily. Avoid using fleece and velour. Advocate for your baby. It is okay to remind staff and visitors to clean their hands. You are your baby's voice and best advocate. One helpful tool to use in the NICU and as you get ready to go home is the Compass by March of Dimes app. This app has some great features, including journals and trackers, a list of questions, glossary of commonly used terms, community and resource libraries, directory for NICU Family Support hospital partners, link for local NICU family support resources, and postpartum checkup review. Thank you for your help in keeping germs away. If you have any further questions, please ask your baby's medical team.